Hi, welcome to this edition of What's Happening at Tri-City Medical Center. I'm John Bonasaro, and I'll be your host for this program, made in collaboration with KOCT, North County's channel, and Tri-City Medical Center. Our goal is to keep you informed about health issues, events, and services at your local medical center, and to provide you with information for a healthy lifestyle. This episode features Dr. Jason Curry, who practices physical medicine and rehab at Tri-City Medical Center. Dr. Curry specializes in non-surgical approaches for the treatment of cervical, thoracic, and lumbar spine pain, as well as joint pain. His goal is to help restore physical function and activities of daily living by improving the quality of life for his patients. Welcome, Dr. Curry.
Thank you.
Let's start by finding out what exactly is physical medicine and a rehabilitation doctor.
So a PM&R doctor is a type of doctor who has gone through 4 years of medical school, and then they go on to complete a 4-year residency training in the field of physical medicine and rehabilitation, also known as physiatry. Relative to other specialties, our specialty is sort of younger and newer. We traced our origins back to the 1920s when tuberculosis and polio diseases were rampant, causing a lot of deconditioning of folks. And so the field of physical medicine was created to try to help those patients regain their strength. And then later in the early 1940s, when our vets were coming back from World War II, the field of rehabilitation medicine was created with the goal of trying to oversee the veterans' rehab process and recovering from their injuries in their wounds sustained in war. And so in the late 1940s, because of the similarities between physical medicine and rehab medicine, the two fields were combined to form physical medicine and rehab to what it is today. So you can think of our PM&R doctor as a combination of several different specialties such as internal medicine, orthopedics, neurology, a little bit of sports medicine combined with an emphasis on physical therapy. And so you get a unique standpoint from a PM&R doctor's treatment options. In residency, a PM&R doctor will learn how to take care of patients with brain injuries, spinal cord injuries, strokes, wound care, pain medicine. And so the scope of practice of a PM&R doctor can vary widely depending on which area of specialty that particular PM&R doctor wants to emphasize in the practice.
Let's flesh this out a bit. So what does an interventional physiatrist do?
So an interventional physiatrist relies on doing interventions. They master interventions and trying to help that patient recover from their pain and improve their quality of life and improve their function. In general, an interventional physiatrist can master things like joint injections, muscle injections, and spine injections, again, with the emphasis of trying to decrease pain and thereby improve the patient's quality of life. Describe
what an EMG nerve conduction study is.
So that's a type of test that a physiatrist will frequently perform on patients. An EMG can be thought of as a nerve test to look at the function of the nervous system, whereas an EKG is a study of the heart, and EMG will study the nervous system. And so the test is performed in two different parts. The first part consists of placing small electrodes on the body. It's the same kind of electrodes that are placed for, say, an EKG. And then the nerves are stimulated. And when the nerves are stimulated, the machine can record the response of the nerves, and that will tell you about how the nerve is functioning. The second part of the test uses a small needle the size of an acupuncture needle to listen to some of the sounds of the muscles, and that again will tell you about the health of the nerves.
Is this a test that's done early in the process? Is this part of the diagnostic process?
It is, and a lot of times these tests will be ordered by other physicians other than the PM&R doctor. For instance, say an orthopedic surgeon is evaluating for someone that they suspect has carpal tunnel syndrome, which is when a nerve gets entrapped in the wrist. An EMG test can help decipher if that is indeed happening. And so other instances where an EMG test may be ordered would be if a patient is complaining of numbness or tingling in their feet. An EMG test can look for possible peripheral neuropathy. Sometimes people will have a pinched nerve in their spine that will send pain down the legs or down the arms. And so an EMG test can help assess for that to help get a diagnosis and potentially a prognosis.
What are some of the things that should trigger a patient to think about going down this route and seeing someone like yourself?
Anytime someone's in a lot of pain for a long time, months, years, or pain that is affecting their quality of life, it's a good idea to see a health professional. Specifically, if that pain involves the musculoskeletal system, so back, neck, arms, legs, an interventional physiatrist may be someone that can help you. The interventional physiatrist will help figure out, number one, what's going on, so they'll help get a diagnosis, as well as discuss treatment options and provide education about that particular diagnosis.
Well, speaking of treatment options, what are some of the options you offer?
Treatment options can vary pretty widely depending on what the particular diagnosis is. One of the first line treatments that I always recommend to my patients is physical therapy. In fact, physical therapy is the best long-term non-surgical treatment option for someone's pain, particularly if it's a musculoskeletal pain. And so the goal of everything I do is to try to help someone get in with a physical therapist, to get on a daily home exercise program if they're not on one. That's the best long-term non-surgical solution for musculoskeletal pain. And so sometimes I may rely on a medication or some type of injection to help decrease the pain to, again, reach that goal of getting someone active again and getting someone on an exercise program.
You know, it seems like one of the biggest decisions is surgery or not. So how is that decision made? Is that made in conjunction with someone like yourself?
Yeah, so the question of surgery versus non-surgery can be a very complex question. It requires you to individualize your treatment plan to that particular patient. And so it's important that a doctor looks thoroughly into what's going on to discuss possible treatment options. The decision for surgery can be based off of how much pain someone's in, and additionally you have to look at what other things are going on in that patient's life. There are a lot of other medical conditions that you have to take into consideration when deciding if someone should have surgery or not. And so I think that's a big advantage of coming to our group at Orthopedic Specialists in North County, is that we have non-surgical specialists such as myself working alongside surgical specialists, where we have orthopedic surgeons who have subspecialized in virtually every aspect of the body. And so together as a team, we all collaborate with each other to come up with the best treatment option for the patient.
Just to be clear, surgery doesn't mean you're not someone they should see. It's not just the decision whether to have surgery or not. You offer after surgery treatment as well.
Correct. And again, I have to emphasize that's an advantage of coming to our group, is that we all work together as a team to help that patient get better.
So how would someone get to see you and your group? Is a referral needed?
Sometimes it really depends on a particular insurance. And so our group can help with that. If someone would want to visit our website at orthonorthcounty.com, there's a lot of information on that, and we can help someone get in to see us.
And what can people expect in an initial visit?
At the initial visit, we'll take a good thorough history. We want to figure out what's going on with your pain, why you're having that pain, and so basic imaging such as x-rays may be ordered at that initial visit. And then we'll come up with a further plan for treatment, which may include ordering further testing such as the EMG or an MRI to further figure out what's going on. And then once we get that diagnosis, we'll come up with a treatment plan.
Well, thanks for that great information. We appreciate it.
Thank you.
For more information on spine and joint health, please visit tricitymed.org.
Tips from Tri-City Medical Center. Schedule your annual checkup with a Tri-City affiliated primary care physician in your area. Physicians which are currently open to accepting new patients can be found on our website at tricitymed.org/primary care. Read through physician bios and watch physician introduction videos on our website, or call our 24-hour physician hotline. Tri-City Medical Center, advanced healthcare for you.
Welcome to What's Happening at Tri-City Medical Center. This episode features Dr. Jason Curry, who practices physical medicine and rehab at Tri-City Medical Center. Dr. Curry joins us to talk about spine and joint health. Doctor, what kind of back and neck pain do you evaluate and deal with?
Well, I treat all aspects of back and neck pain, which can be a complex thing. And so I brought in a spine model today to sort of illustrate different areas of the spine that can cause pain, just so everyone can get a feel of the different areas that can cause the pain to begin with. And so this is a model of the lower back or the lumbar spine. And this is looking at someone from the back side here. And so from the back, you can see the sacrum, and that connects to the lumbar spine vertebrae. And so each vertebrae, I'm going to turn the spine sideways here, each vertebral body is connected to each other in these things in the back called the facets or the lumbar spine joints. And you can think of these facets almost like Legos, where each part of the spine connects to each other. And these joints are true joints, just like any other joints of the body, hand, wrist, knees. These joints are true, what we say, synovial joints, in that they have fluid in them, they have cartilage in them, and these joints over time can develop arthritis, which can cause an aching pain located in the back. Typically does not radiate down the legs or down the arms because it's not a pinched nerve type pain, it's a joint pain, and so someone will experience confined pain to the back or neck. So that's one area of the spine where someone can develop pain from. Going back to the side view here of this model, between each vertebral body is a disc. This disc has a job of trying to cushion the vertebral bodies so that they have cushion and that you don't get bone-on-bone contact. These discs are the discs that someone will herniate. You hear someone say, I herniated my disc. What that means is this disc actually can protrude out and come out here and contact the nerve root. And you have a nerve root leaving the spine at every level, and these nerve roots run down the legs or run down the arm, depending if it's from the neck. And so if a disc herniates and hits a nerve root, it'll send pain down the arm or down the leg. And so that's a different type of pain quality that you have to evaluate for. And finally, one of the other common areas of back or spine pain that someone can develop pain from is something called central stenosis. What central stenosis is the word stenosis is the medical word meaning narrowing. You can think of it as tightness. That's where you can get narrowing inside the spine itself around the spinal cord, and that can constrict the spinal cord, causing pain. So those are some very common areas of the spine that I treat.
In stenosis, is the pain limited to the back, or does that radiate, or could it be either way?
It could be either way. It depends on what kind of stenosis. If it's central stenosis, typically it's confined to the back. It'll maybe radiate down into the back of the buttocks or the thighs. If it's something called foraminal stenosis, which is narrowing around the nerve root at the foramen or the opening where the nerve root exits, that will send the pain down the arm or leg.
So obviously there's a range of treatment options. Are they significantly different for those three conditions that you mentioned?
They are. They're very different. And going back to sort of what my goal for patients is to decrease their pain, thereby getting them in with a physical therapist to set up a home exercise program or help them resume that home exercise program they were on before. And so depending on the type of pain generator they have, an injection may be offered to help with that pain. For instance, if it's a pinched nerve that someone has a problem with where this disc is herniating out or pushing out on the nerve root, something called an epidural steroid injection may be offered. An epidural steroid injection is a little bit different than an epidural a female may have when they're giving birth in the hospital. What an epidural steroid injection is in the pain world is using an x-ray machine called a C-arm or a fluoroscope, and you use that x-ray machine to safely guide in a needle around the pinched nerve, and then you inject steroid to decrease inflammation and decrease pain.
Is that an in or outpatient procedure?
This is an outpatient procedure. It is.
And is there a limit to the number of these? How long do they last? Can you give us a little more detail about that?
Yeah, so remember, the goal overall here is to decrease pain so that someone can resume their exercise program or get in with the physical therapist. And so if I offered someone an epidural injection and their pain significantly improves, then the next step is for them to resume those exercises. If down the road their pain comes back or flares up, sometimes the injection is repeated, But the intention should be to try to get that person back in exercising. And so the number of injections you'll hear frequently amongst patients who have had family members get them. They may get a certain number, that sort of thing. I find it's best to individualize my patient care to how that particular patient's doing.
So you're working hand in hand with the physical therapist then?
Yes, exactly.
Part of medicine is of course jargon, just like any other profession. And just for purposes of comparison, what would be the difference between an epidural and a medical branch block, for example?
Right, so a branch block, a medial branch block, targets the joint arthritis. So going back to our spine model here, earlier I discussed how someone can have arthritis of the joints of the spine. And so joint pain is best targeted with something called a medial branch block or facet block. The medial branch is this nerve that I have the tip of my finger on right here. Its job is to do the feeling or the sensation of this joint. And so with the medial branch block, a needle is directed on top of this little nerve, and you inject some numbing medicine, which will then take away the sensation of that joint to decrease pain. So that's a very different procedure than, say, an epidural steroid injection, when the needle is actually coming into the epidural space to target the pinched nerve.
Would the purpose of the medial branch block be to go and exercise or just to get rest?
So a medial branch block is done for a couple of different reasons, both diagnostic and therapeutic. Therapeutic in that hopefully someone will get better with the injection. Diagnostic in that if their pain goes away with this injection, then we have now proven that's where your pain's coming from. And so a couple of different pieces of information will be gathered from that type of injection. Again, sometimes when you perform a medial branch block, the pain will go away and stay away. And if that's the case, then the person should resume their exercise program and once again get in with the physical therapist to set up an exercise program. Sometimes someone's pain will go away temporarily with a medial branch block, and then their pain may return. And for those cases, there's a procedure called radio frequency ablation, or RFA for short. RFA is when the needle comes back to the same place that it did before with the block, but instead of putting numbing medicine there, you heat up the tip of the needle 80 degrees Celsius, and you actually burn away that nerve to the joint, and you take away that joint sensation to have longer pain relief.
Is that something that has to be repeated? It sounds like not. It sounds like that's a one-time.
Well, nerves in our bodies are remarkable in that they can regenerate and regrow. And so studies show 6 to 12 months is usually the window for those kind of nerves to be regenerated. And so 6 to 12 months down the road, someone may experience their back pain or their neck pain returning. If that's the case, then the procedure is then repeated. Typically after a few RFA procedures, the nerve stops regrowing. But again, I can't emphasize enough, enough that that's the whole reason why it's important to have a good exercise program and to work with a physical therapist, because what you do not see on the spine model are all the muscles that are connected to the spine. Where my hands are here in our body, this is all muscle. And so as you strengthen these muscles to support the spine, you'll have your best long-term non-surgical treatment options for your pain.
We've done a great job of taking a complicated issue and breaking it down into its parts. I realize that's not easy. Thank you very much.
Thank you.
For more information on spine and joint health, please visit tricitymed.org.
Tips from Tri-City Medical Center. Get screened for potential health issues, including cardiovascular abnormalities, breast cancer, and lung cancer. Our Cardiovascular Health Institute offers an array of heart screenings under $100, including a comprehensive heart risk assessment with a private 45-minute consultation to review your risk profile and EKG. Sign up for a screening today for a healthier tomorrow. Tri-City Medical Center. Advanced healthcare for you.
Welcome to What's Happening at Tri-City Medical Center. This episode features Dr. Jason Curry, who practices physical medicine and rehab at Tri-City Medical Center. Dr. Curry specializes in non-surgical approaches for the treatment of cervical, thoracic, and lumbar spine pain, as well as joint pain. His goal is to help restore physical function and activities of daily living by improving the quality of life for his patients. He joins us today to talk about spine and joint health. Welcome, Dr. Curry.
Thank you, John.
Let's talk about something that I see in your hand there, I'm going to guess, is a spinal cord stimulator. How does that work?
So a spinal cord stimulator is sort of like a pacemaker for the heart. It's a pacemaker for the spine. And so I brought in a spinal cord stimulator, some demos here to show everyone. This is a spinal cord stimulator lead. It has little tiny electrodes at the tip of these leads, and these leads can be implanted inside the spine, and you can turn the device on to scramble pain sensors in the spine to take away someone's pain. Particularly if that pain is a burning type pain in the leg or foot, this works really great for that. It replaces that sensation with the buzzing sensation that's painless, or depending on the type of frequency that's programmed into this device, sometimes it takes away the pain completely without a buzzing sensation. And so I brought in a spine model as well to kind of demonstrate this. These are the leads again, and they get placed inside the spine, and they run up inside the spine. And at the top of the spine model here, you can see these spinal cord stimulator leads placed inside the spine, and these are the leads that get turned on to scramble the pain.
Is this a type of surgery?
It is. It's a unique thing in that there's typically two parts to a spinal cord stimulator process. It's very unique in that there's something called a spinal cord stimulator trial and then an implant. With the spinal cord stimulator trial, it's sort of like test driving a new car for the week, and then you take it back to the shop a week later and decide if you want it or not. So with the spinal cord stimulator trial, these leads, through the assistance of using needles, are actually placed through the skin and inside the spine. And then the leads are taped down to the back and plugged into an external battery that someone will wear for the week. And they go home like that for a week and get to try out the device. During that week, a representative with the company that makes this technology will be in contact with the patient. And there's all sorts of programs that they have, a laptop that they can use to program the electrodes individually. And their goal is to hopefully take away that patient's pain. And so during the week of the trial, it's unique in that the patient gets to try it out and decide if they like it or not. A week later, they'll come back to the office to see me, and at that time, the leads will slip out of the back in the office, and the patient will get to decide if it's something that changed their life significantly, and if so, then we'll schedule them to have it implanted. Or if it doesn't help a whole lot or they didn't like how it made them feel, there's no strings attached, the leads come out, and we just don't implant.
How long has this treatment been available?
It's been around for a good 50 years, but over the last 10 years, they've made remarkable success with technology. These leads now, there are several different companies that make this technology, but some of the best technology that's out there will have the ability to scramble each individual electrode to scramble away the pain, as well as MRI compatibility.
So how does this actually work? Is there a controller that you have with it? Do you decide as the patient when it's needed?
Right, so if a patient has this device implanted, they get a remote control to use at home, and I brought in a remote. So this is a typical remote. It's sort of like a small TV remote, and this remote can turn the device on or off. It can adjust the type of frequencies and the type of stimulation being provided inside the back, and so the patient has the ability to basically have the controls in their hands.
Is this something that stays on typically almost all the time, or just a couple minutes a day, or could it be anything in between?
It can be anything in between. There are some safety issues such as driving. We wouldn't want you to have it on while driving. But in general, someone can have it on as much as they want. And again, they have the controls at their fingertips.
Now, do you have to be tethered to power, or is it, does the battery give you significant freedom?
So the battery during the week of the trial is external, and so it goes on to a little pack that the patient wears for the week of the trial. If they decide to have it implanted, a battery will be implanted underneath the skin. And I brought in an example of a battery here. So this is a very small battery. As you can see, it fits into the palm of my hand. This battery is a rechargeable battery, and so it can recharge through the skin, sort of like Bluetooth recharging technology. Depending on how often someone uses this machine will depend on how often they need to recharge it. But the charger just is placed right up against the skin where the battery is inserted, and it charges through the skin. And there are also non-rechargeable batteries. If someone is worried about having to recharge it, we can place a non-rechargeable battery on the skin as well.
How successful is this in your experience?
In general, if a spinal cord stimulator is placed for the right reason, it's very, very successful. And that's, again, an advantage of this whole system overall, is that going back to that trial where you get to try it out for a week, and the patient then can experience what the device feels like, and then they'll be able to make an informed decision if they want to have the device implanted or not.
Now, at the beginning of this, I think you said the burning pain symptom is an indicator. Is that how you know if you're a candidate for this, or is this something that takes deeper investigation before you would recommend it?
So in general, a spinal cord stimulator is done when all other conservative treatment has been exhausted. So we want to make sure someone's had physical therapy, medication management, perhaps injections. We want to make sure all of the more simpler things have been done before they go on to have a spinal cord stimulator system. There are different diagnoses that qualify for a spinal cord stimulator. If someone has burning pain in their legs, that's a very good reason to have a spinal cord stimulator if they are a non-surgical candidate. And again, the question of a stimulator can be complex depending on if you have a herniated disc that's causing your pain. Perhaps addressing that herniated disc is the better way to go without a spinal cord stimulator. But it's not, spinal cord stimulators are not just done for pain due to the spine. We actually see a lot of success in other areas of medicine, such as, I can give you a couple examples, some patients in general that I've treated. I saw one patient who had a history of hip surgeries, and this patient had a lot of burning pain in the side of their hip that kept this patient awake for many years. They were unable to sleep and get a good night's sleep. They were sent in to see me for evaluation. I talked to them about this treatment option, and this patient did wonderful with the trial, and the patient went on to have an implant, and they're very, very happy now, able to sleep through the night and do the simple things of life, which made a huge difference for this patient. Other areas that it can be used, peripheral neuropathy. So sometimes people have a severe burning pain in their feet that's not responding to medication, and they exhaust all other treatment options. I've seen this done for peripheral neuropathy. In fact, one patient had a 95% improvement in their peripheral neuropathy, and they were able to get off of all their pain meds. So
is this covered by medical insurance, by the way?
It is. It's covered by medical insurance.
Well, that is great news, great information. Thank you for joining us.
Thank you for having me. I appreciate it.
And thank you for watching. For more information on spine and joint health, please visit tricitymed.org. You've been watching What's Happening at Tri-City Medical Center. This series will keep you informed about health issues, events, and services at Tri-City Medical Center and provide you with information for a healthy lifestyle. You can view past episodes on video on demand by visiting koct.org. We'll see you next time.